Eccentricity index is an echocardiographic index for separation of right ventricular volume and pressure overloads. Abnormal motion of the interventricular septum can occur in both right ventricular volume and pressure overloads. Ryan and associates have described a method to differentiate between the two. Two left ventricular minor axes are measured, one parallel to the interventricular septum and another perpendicular to it. Measurements are made both at end diastole and end systole. In normal subjects, the ratio between the two is equal to 1 at both end diastole and end systole. In patients with RV volume overload, the end systolic ratio is approximately 1, while that at end diastole is increased. In those with RV pressure overload, the eccentricity index was significantly greater than 1 at both end systole and end diastole. Thereby, eccentricity index of LV shape reflects the abnormal motion of the interventricular septum depending on the type of RV, whether systolic or diastolic overload. Eccentricity is reflected in the D-shaped LV cavity seen on echocardiography in severe pulmonary hypertension and right ventricular hypertrophy. This is an echo image from the parasternal short axis view. Normally, the LV cavity has a circular shape in this view. When there is RV volume overload, the interventricular septum bulges towards the LV and the LV cavity assumes a D shape in diastole. But as the LV contracts in systole, the pressure rises above that of RV and the LV assumes a circular shape. When there is severe pulmonary hypertension associated with elevated RV systolic pressures, the interventricular septum bulges into the LV in both systole and diastole so that LV cavity has a D shape throughout. In the echo image shown, right ventricular trabeculae are grossly hypertrophied, marked by the green arrows.